Okay, our favorite vet is back. It's been a while. We're so happy to have you back. You are going to talk about heartworms and leptospirosis. Did I say it right?
You did perfect.
Yes, and why pet parents really need to be vigilant.
Yes, yes.
Dr. Molly, you said you've been seeing this in a lot of pet parents that are moving here to Nashville.
We are. Yeah, so heartworm is here. It is prevalent in this area, and I would say we are seeing an uptick in cases. I talked to colleagues that agree, and I think a lot of that has to do with people are moving here so fast from all over the country, and heartworm is more prevalent in certain areas, and so there are definitely cases of dogs who come from places like areas of California, further west, that were not on heartworm prevention where they came from. They got here, their owners didn't need to go to the vet right away, so they didn't know they needed to have their dog on prevention. So they weren't protected from it, they get infected, they come to see us, we run a test and find that they have been infected with heartworms.
And then it can be quite a lot of work to get rid of them.
You don't want to have to treat them.
No, we've got a great visual of the life cycle of heartworm that I'd love to pop up and have you kind of explain it to us.
So the life cycle of heartworm is very interesting. So there are a couple players involved. A lot of people don't realize that the mosquito is actually what carries the heartworm, the larval stage of the heartworm called microfilaria. And when a mosquito bites a dog, if the mosquito is infected, it actually injects some of those larvae into the dog's bloodstream. And if a dog is not on heartworm prevention, then those baby heartworms, for lack of a fancy word, are allowed to mature into adults. And so once they become adults, they move into the heart and the vessels between the heart and the lungs. And there they mature, they get married, as my teacher in vet school used to say, and have lots of babies and make more baby heartworms that then become more adults. They live for 5 to 7 years, and so they just reproduce and make more worms that cause more of a problem.
And we have a photo of kind of the map showing where in the country, back from 2019.
Yes.
And it's probably different now.
Yes, the American Heartworm Association has all of these visuals for people to see. This was last done in 2019, so it's worse now. But this just shows the darker the red, the more prevalent, the more concentration of cases there are. So there's a little spot in the middle of Tennessee. You can see there's a lot of cases here. And then the further west you go, the lighter that map gets, because there's just less cases in some areas where it really isn't even present in that area.
Right.
So some people just have no idea about it.
Oh my gosh. Okay, so lightening up that map, how do we prevent this?
So the great thing about heartworm disease is it's very preventable. So there are several products on the market that prevent those baby heartworms from becoming adults. So that's what prevention does. There are topicals, there are oral preventions, and there are even 6 and 12-month injections that can protect your dog from heartworm disease. So it's important that people are diligent about testing for it when they see their vet, when their vet recommends, and getting them on prevention and keeping them on prevention.
And just to hit home, I'd love to take a look at a photo of what heartworms look like, because you don't want your dog to get them.
Yes,
they're gross.
Yes, these are adult heartworms, and that is actually what physically lives in the heart and the vessels of a dog that's infected.
And it's very dangerous for the dog.
It's very dangerous. Once they get enough of these worms in their heart and their vessels, they can go into heart failure. And the tricky thing about heartworm disease is most dogs are not going to have symptoms until they have more advanced disease. Wow. So once you notice a symptom, it's, your dog's probably very sick, and that's why we test every year to catch those early cases, because you want to treat it as soon as you catch it.
Thank you. Now we have about a minute left. Lepto.
Yes.
Quickly kind of break that down for us.
So I was hoping we could have time to talk about leptospirosis. It is a bacterial infection that we do have. It's prevalent here in the southeast. The part of the Midwest has it as well, the East Coast. It is a bacterial infection that dogs usually catch from water that has rodent urine in it, actually, is the most common way they get it. It can be transmitted from really any mammal. It's also zoonotic, meaning dogs can give it to people and vice versa.
Okay.
Yeah, so that's the scary thing about it. Our dog patients that get lepto usually have kidney or liver failure. It can be very dangerous, but we do have a vaccine that can prevent the common types of lepto. And again, it's something that in other areas of the country, your vet's probably not going to recommend it. And so if you come from another area, you move here, you should definitely get a vet as soon as possible. Ask them what vaccines, what preventions are appropriate for your pet.
I love
Thank
that.
you.
Yeah.
You're
Yeah.
welcome.
Very
Thank
good
you. If you're coming
information.
here from other areas, please go see Dr. Molly. Go see a vet for sure.
Yes.
But if you want, go see Dr. Molly
Yes.
too. You can make your appointment with her by contacting this animal hospital.
Beauchamp Animal
Beauchamp.
Hospital.
I knew I was going to say it wrong. Beauchamp Animal Hospital at beauchampanimalhospital.com.